Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach, and in this video series we're talking about non-surgical spinal decompression. If you'd like to watch the previous video, I explained to you my personal story and why this is so important to us in our practice. But in this video I want to talk about what is non-surgical spinal decompression, how does it differ from traction, how does it differ from inversion tables. Okay, so basically non-surgical spinal decompression, it's a technology that was developed probably about 10-15 years ago, but it's been used very, very consistently and very effectively for patients to help them avoid back surgery. So basically in our office, the machine that we use has a tower on it, and it's got a screen that we use for our computer aspect of the program. The patient will lay on a table, and the table has two parts. The first part, so the patient's laying here like this, has a leg bolster. The patient has a harness around the upper part of their body that goes and hooks into the top part of the table. There's another harness wrapped around the bottom part of the body that runs in and goes into the tower. In this tower, we can set the angle of the pull to target different levels of the spine. So if you have an L3 disc herniation, we can target that area. If you have an L5 disc herniation, we can target that area. We like to do a pull that affects as many areas as possible to really try to get a good decompressive effect, but if we have to specifically hit an area, we can work for that. So what will happen is that the machine will pull in this direction. So the traction is pulling in this direction, I'm sorry, not the traction, the decompression is pulling in this direction, and you're anchored in this direction, so you have an opposite force in that direction. So your body is being stretched in essence. And what that does is when you have your vertebrae in your spine, they look like this, you have an opposite effect on those vertebrae that opens up the joint space. This joint space is where the disc is. So if you have a disc that's bulging in that area and you open up that joint space, that can reduce that pressure of that disc out in the area where the nerves are. So it can take the pressure off those nerves. So by doing this, we get in there and we do this pull, and we can reduce that pressure on the nerve through this decompression effect. Now, how is this different from inversion versus traction? So in traction, basically, it's a similar setup. You're sitting in, you're anchored in, you've got two opposite forces pulling. But what will happen is the traction table will pull, and when it pulls, the body and the muscles, if this joint is injured, the muscles around that joint tend to try to protect it. So when the pull starts happening, these muscles will tighten up to protect that joint. So in traction, the traction machine pulls against the muscles. So you have this battle that's going on. When that's going on, you can end up injuring the back and injuring the disc area even more because you create more pressure because there's this battle going on. So that's traction. Now, decompression, what happens is there's a program inside the tower, and the motor senses when that tension increases, when that muscle tension increases. So when that happens, the motor will release and let those muscles relax. So slowly but surely the decompression will work through the muscle guarding and allow these vertebrae to separate to give you that space to get that pressure off the nerve. Okay, so decompression, the difference between that and traction is that the machine uses a logarithmic equation that somehow this does it. It's beyond my understanding. But it actually allows for the muscles to relax so that your body's not fighting against it. So then you get that full decompressive effect, and you have that increased joint space between the vertebrae, which takes the pressure off the nerve. So that's the difference between decompression and traction. Now, with regards to an inversion table is a beautiful thing. I love inversion tables. The challenge with an inversion table is that when you're on an inversion table and you get that inverted positioning, it's the same effect that you would have with a traction table. In other words, when you get that traction effect on that vertebrae with those muscles, the muscles can guard and it can actually cause problems. So with an inversion table, those are great for maintenance. They are great for non-acute situations. They're great for a lot of different situations. But if you're in an acute situation where you're having chronic pain down the leg and it's not resolving with an inversion table, that doesn't mean that decompression will work. That actually makes you even more of a candidate for decompression because that means that your body is guarding against it. So decompression is very, very specific to the vertebrae. It helps to reduce that space, or I'm sorry, increase that space to reduce the pressure on the nerve. and it can help you in ways that are different than inversion and traction. And then you can go back when you're done with your decompression protocol. If you need any kind of maintenance or anything, then you can go back and use an inversion table for maintenance, and that's a great combo. So that's what decompression is. Our next video, we're going to get a little bit more in detail.